Back pain can be crippling, and for many people, traditional spinal surgery is an expensive last resort and not always successful. Now, a groundbreaking FDA-approved procedure is giving chronic sufferers new hope at roughly half the cost. 11 News reporter Sherman Chow takes us inside the OR.
11-year-old Joe Patterson is hard at work.
You want something to drink?
Eager to help his mom, who needs it.
Help my mom get through this surgery.
It's a sharp, throbbing pain.
For 2 years, Gracie Patterson's back pain has been debilitating.
There's sometimes in the morning that I can't even get out of bed.
She's had 7 foster children, but no more. And traditional back surgery is not an option.
It takes 6 to 8 months of recovery. And I can't do that because I have a special needs child.
Like millions of Americans, Gracie's spinal nerves have gotten squeezed, causing pain. To relieve pressure, surgeons traditionally carve out some bone, but that weakens the spine. Now, Dr. GROVER is using a new procedure which changes that. A series of needles and live x-rays help map the target area and the nerve area.
A needle so we can put dye, what's called a...
Then through a tiny incision, a metal tube is aligned and instruments begin shaving a little bone, but mostly enlarged ligament.
And we'll do it in bites to free up that ligament.
So this is sort of a before and midpoint during the procedure. The dye here won't go through, showing how completely compressed that nerve is in this white area. Halfway through, the dye already shows a dramatic improvement where the pressure is being released on the nerve.
She's like this.
At home, Joe is waiting to help the mom, who has always helped him.
It's because I'm adopted.
Now they are sharing another chapter of their lives.
It's just second chance.
In Magnolia, Sherman Chow, 11 News.
Good luck with that procedure. We will check back in with Gracie in a week to see if that procedure worked, to learn if... A few weeks ago, we visited with a local mom suffering from a debilitating back problem. 1.5 million Americans are diagnosed with the same spinal problem each year, but she became one of the first Houstonians to try a new procedure that reportedly cost half of what you'd pay for traditional back surgery. Recovery time is also reduced from months to days. Sounds great, but does it really work? 11 News reporter Sherman Chow went back to find out.
Like this, and just had to jump. Like she just pushes herself up, like struggling really hard.
Joe Patterson's mom literally had to crawl up the stairs, and that was before her back pain got really bad.
We had to close the upstairs down.
I could see her struggling, and I hate that.
Gracie Patterson has had 2 years of chronic pain, daily medicines, a rolling walker, and a cane, all because of severe compression on her spinal nerve. Last month, Dr. GROVER used a recently approved FDA procedure on Gracie. He is decompressing the spinal nerve without cutting away a lot of bone.
And I will debulk that ligament, and we'll do it in bites to free up that ligament.
The black line is the spinal nerve. The white area is where it's been squeezed and where the pain is. Halfway through the procedure, a dramatic improvement.
It's breakthrough stuff. You know, I believe it's going to change the way that we treat this condition.
Ask Gracie, who days later was walking unassisted to check her mail.
And I'm able to do things around the house that I hadn't done in 2 years.
Gone are the cane and the daily medicines.
No patches, no anti-inflammatories, no pain pills, and no muscle relaxers. I have a brand new life now. There is absolutely no pain.
She is even doing stairs again.
My husband has me back. My son has me back.
Small steps that have a huge impact. Sherman Chow, 11 News.